This is the Go Training, Module 4.3, Safe and Dignified Burials. By the end of this session, we would like you to be able to describe basic features of safe, supervised, and dignified burials, state how safe burials are critical to stopping Ebola outbreak, and identify how each area of work in the response relates to safe and dignified burials. So let's go back and look at the framework of response. There were 4 areas, if you can remember. The 4th area, social mobilization, underpins the other 3 areas. And the other 3 areas were case management, contact tracing, and active case finding. And the 3rd area is the area that we are going to cover in this module, safe and dignified burials. This is a very, very challenging area of response for anyone who's involved in it. It is at a moment when Ebola has claimed a life, a family member has passed away, and we as responders are also involved in that if we are part of the Safe and Dignified Burials team. So this is a very serious time in the Ebola response, so it's very important that all of us, regardless of the fact that we're working on in this area or not, understand what happens. So let me ask you just to take a couple of moments and to ask yourself this. What do you understand by safe and dignified burial? And can you describe why safe and dignified burial is so critical to stopping the spread of Ebola? What do you understand by safe and dignified burial? And why is this particular intervention so important to stopping the spread of Ebola? So take a moment and jot this down on a piece of paper. Reflect on what you wrote. So, from the response point of view, we know that bodies of dead Ebola patients contain very high levels of the Ebola virus. And this is the virus that causes the Ebola virus disease. We also know that at least 20%, that's 1 in 5 of new Ebola infections, occur during the burials of deceased Ebola patients. So this is a very, very high risk time in the work that we do. Ebola infections occur during burials when family and community members perform traditional and religious rites. This requires, usually in this part of the world, direct touching of the dead person, of the family member, of their loved one, washing the body by family members, and family members distribute the personal property of the loved one, which may be infected with the virus. Now, it is extremely to understand the social, cultural context of where people live and how people live in these 3 countries. Death is a very, very important moment for certain duties and rites to be performed. So disregarding this is actually a very, very dangerous thing. First, we need to understand these rites and then find a safe and dignified way in order to bury the person who has died from Ebola or cremate them as is appropriate. The most important thing to do, apart from stopping transmission, is to show respect and dignity for the deceased. We have to remember this was a father, a mother, a brother, a sister, a child of a family, of a community, of a village, of an urban setting. The burial process is very sensitive for the family, as you can imagine, and to the community, and can really become, if badly handled, the source of community resistance or even conflict beyond this particular event. It could be for all Ebola response. So before starting any procedure, the family must be fully informed about the dignified burial process and their religious and personal rights to show respect for the deceased. So no burial should begin until a family agreement has been obtained to do it this way. Traditional burial practices in West Africa include the preparation of bodies for funerals, and burials include practices such as wiping, massaging, kissing, and embracing the dead body. Respect for the dead is demonstrated by attending funerals, and the mourners will also kiss and touch the body. Funerals and funeral rites may go on for several days, and bodies are washed, wrapped, and buried. Remember, up to 20% of new infections are related to the burial, the unsafe burial of people who have died from Ebola. So it's important for you to know that a protocol on safe and dignified burials was developed, and the work started in September 2014. And it really, the team that came to do it shows all the different expertise that was required. WHO, the International Federation of Red Cross and Red Crescent Societies, and faith-based organizations such as the World Council of Churches, Islamic Relief, Caritas, World Vision, and others. And the protocol outlines step-by-step processes for safe and dignified burial. And it encourages the inclusion of family and local clergy, traditional healers, whoever has the role to perform this in the community, in the planning, the preparation, the burial, and also during the burial. It provides specific instructions for Muslim and Christian burials. As you've seen, this has been done in collaboration with religious leaders. The protocol also includes ways for Ebola burial teams to carry out their work safely while respecting family sensitivities. So it's very important to know that when first meeting with the family before the burial, it's important that trained burial teams are not wearing personal protective equipment, the full equipment, because that can be very disheartening and very frightening, if you like, for the family. And the team has to ask the family if there are specific requests for managing the burial and personal effects of the disease. So let's go through these steps very quickly. And the purpose of this is not to train you in safe and dignified burials. That will be done on the ground. But this is for you to understand what is involved, because as part of a response team, people may ask you. Number two, this is also a way of understanding how our work contributes to this area of work. And third, this allows us to understand the very high risk and emotionally demanding work that our colleagues working in this area have. And there may be opportunities for you to support them during their missions as well. Step one, prior to departure, the team, the burial team, the trained qualified burial team composition is determined, and they prepare the disinfectants and the other equipment they may need to take. They assemble everything they need to take. Step three, they arrive at the deceased person's home and prepare with the family, evaluate risk. Remember, as you can see in the diagram, don't come in full personal protective equipment, but this is a meeting. But practice hand hygiene and other protective methods to make sure that you are not exposed. The fourth step is to put on all personal protective equipment after the consultation with the family and after everything else has been done. Step 5, the placement of the body bag on the floor. Step 6, then placement of the body bag in a coffin where culturally appropriate. Afterwards, sanitize the family's environment. Remove, after that, the PPE, manage waste and perform hand hygiene. The next step is to transport the coffin or the body back to wherever the final rites will take place, to the cemetery or an appropriate place. And then burial at the cemetery. Place the coffin or the body back into the grave. The burial at the cemetery is the next step, engaging the community for prayers, as this really helps dissipate tensions. It provides a peaceful time, but it also allows the burial rites to be performed, which is very, very important. And it helps those who survive this person to deal with their grief in an appropriate way that is comforting to them. Step 12 is to return to the hospital or to the team headquarters and continue with the follow-up activities. So as you can see, this is very specialized work. People doing this will receive training on the ground, and they will be closely supervised. But now it's time for you to list how this area of work is related to your work, or how your work can contribute to the work in safe and dignified burials directly or indirectly. So take your time and list how your work relates to or can contribute to the work in safe and dignified burials. Please don't forget that this is very difficult for the family, but equally difficult for our colleagues who are working in this area. So I hope this module has not only given you an overview so that you are knowledgeable and communicate to others what exactly happens, that you actually can identify how you contribute to this area of work, and maybe you can even support the specialized teams that do this very high risk and high emotionally demanding work. I will see you in the next session.